Well, tonight Fox Television premieres yet another extreme makeover show. 17 women, ugly ducklings, Fox calls them, are carved up, sliced, pulled, nipped, and tucked into what producers believe are more pleasing packages. Then they compete in a beauty pageant. Extreme makeovers are certainly compelling television, no doubt about it, but have these shows gone too far?
I'll be a new woman when I come back.
Fox's The Swan is just the latest example of nip and tuck reality TV. 17 women eagerly agreed to undergo total body transformation. 3 months of nips and tucks, lifts and cuts, collagen and Botox and chemical peels, and anything else doctors and producers order. The idea, of course, is nothing new. ABC's Extreme Makeover has already been a big ratings success.
I feel like I'm a different person.
So has MTV's I Want a Famous Face, where young people unhappy with who they are use plastic surgery to become clones of celebrities like Brad Pitt or Pamela Anderson. This 21-year-old student wanted a full body tuck so she would look like the actress Kate Winslet. I Want a Famous Face has been a big ratings winner for MTV, but asked network executives to discuss the show, and they declined. In a press release, MTV insists they're just documenting what these young people have already decided to do. And what about those scalpel-wielding surgeons? The president of the American Society of Plastic Surgeons says he's concerned. Patients on these shows, he says, have unrealistic and frankly unhealthy expectations. I've witnessed plastic surgery disasters where someone tried to look like someone else. We can all witness that now every week, thanks to this TV trend. The question is, how far will TV producers and doctors go before someone says enough? Well, joining me from Los Angeles, Dr. Randal Haworth, the cosmetic surgeon who appears on Fox's new makeover and beauty pageant, The Swan. Doctor, thanks very much for being on the program. What about these concerns? This president of the Society for Plastic Surgeons says these shows are a serious cause of concern. The program you're on, starting tonight, women undergo huge amounts of plastic surgery, and then they compete in a beauty pageant. Did you not have any concerns?
Well, of course, we always treat patients as as individuals, and I treat my patients with the utmost confidence and respect, and provide the ultimate in medical safety. But Dr. Rohrach's concern is based upon the fact that he hasn't really seen the show yet. And I do certainly agree that what we've been trying to do with the Swan show is to provide more of a three-dimensional outlook upon plastic surgery, where other shows have sort of left certain loopholes. For example, but a three-dimensional show.
First of all, we've tried to get a copy of the show. They're not sending out full copies. I'm not sure why. But of what we've seen, basically, these people are being asked to be in a beauty pageant after undergoing serious surgery, and Fox is calling them ugly ducklings. Is that something you would call your patients?
I'll be a new woman.
No, I wouldn't. Unfortunately, I'm the plastic surgeon here to provide exemplary care and do what we do best, and being very passionate about plastic surgery. And unfortunately, I didn't have much input into the creative or the artistic side of the actual show itself.
Well, then do you feel you're being taken advantage of at all, or that these women are being taken advantage of at all?
No, I don't think so. I found it an absolute privilege. I felt it a privilege to be able to give these girls the self-confidence to go forward and achieve things in their life that they may not have thought possible otherwise.
As a doctor who's sworn a strict code of ethics and medical code, where do you draw the line? If there's this show on MTV where people want to look like celebrities, so they cut themselves to look like Brad Pitt or Kate Winslet or whomever. Is there a line that you will not cross?
No, there are lines that I won't cross. I feel that when patients come in wanting to look like celebrities, that would venture onto the fact that certain patients, you will not be able to meet patients' expectations, and therefore what will happen is that you'll have a very disappointed patient. To get a patient to look like a celebrity, everybody has different bone structure, skin type, skin elasticity, and so you're going to be met with a lot of unmet results, and as a result, a lot of sort of unfulfilled expectations and disappointed patients.
But do you ever want to say to these patients, you're not so bad, you're not an ugly duckling, you're kind of nice as you are?
Well, that's very true. Plastic surgery is not for everybody. These patients had certain concerns about their looks. In addition, certain patients that we dealt with did not really need too much plastic surgery at all, and it was a very highly individualized process and decision-making process for the patient.
I guess we'll see how they do in the beauty pageant. Dr. Randal Haworth, thank you very much for being on the program. Appreciate it.
Thank you very much.
Let's put plastic surgery in perspective for a moment. 8.3 million Americans underwent surgical and non-surgical cosmetic procedures in 2003. Here's the interesting part: that is up 20% from the previous year alone. The three most popular surgical procedures: liposuction, breast augmentation, and eyelid surgery. Well, a makeover of a decidedly different kind is going on in Texas right now. The